afternoon, guys. Just heading to the house for a few minutes, getting some stuff done, getting some business stuff done. We are still in the hospital. We're day 21, I think, in the hospital. Brian's mom is with him currently, so I can do some work, run some quick errands, and all that stuff. I guess it's been since the 11th. Every day has been running together, so I'll kind of give you what I remember. So we were moved to Utah Valley on the 11th, I believe, the 10th, whatever day it was. It was the Friday. We were moved to Utah Valley. Monday, he started showing signs of, which I was worried about, that he was probably had an internal bleed. Again, that he was bleeding, but I mean, his vitals were stable. So we just kind of watched it. Then Tuesday morning we woke up. His blood pressure dropped to the point where it was low. The high number was low 90s, high 80s. And Brian was pretty insistent that he needed to get up to go to the bathroom, and I told him I didn't feel like it was a great idea, that his blood pressure's been low, and he's like, no, they just checked in, it had increased. I was somewhat unsure because I'd been in and out of the room, and anyway, so we got up, and of course he's got all sorts of blood and platelets and antibiotics and all. I mean, he had tubes coming out of him everywhere. He actually has a PICC line here now. It has 2 lumens. He has a midline here, and then he at that time had 2 other peripheral lines, which they have since pulled. But so I grabbed the IV pole, and I'm like, Brian, I don't think this is a good idea. Like, I can't hold you and this. Anyway, we get to the bathroom door. I was able to push the IV pole in. I was able to grab him because I noticed that he started leaning to the left, and he passed out. So we lowered him to the floor. Luckily, I was able to reach in and pull the emergency call button. The nurse came. We got him up in a chair. His blood pressure was 67/41. That probably won't mean a lot to you guys, but that is really, really low. For you nurses and doctors and healthcare professionals, you know that is a pretty significantly low number. Got him in a chair, had him sit there. They gave him a bolus of fluid. Anyway, so he's pretty much had platelets and blood almost every single day. There's been maybe a day here or there where he hasn't had to. Like yesterday, I don't think he got any blood, or 2 days ago. But yesterday he did get blood, I'm sorry. And then so far today, he's not requiring blood. His hematocrit and hemoglobin are still super low, but not low enough for that. His platelets are low. That Friday that we went to Utah Valley, his oncologist decided to do what's called an in-plate shot. It's not actually for thrombocytopenia caused by chemotherapy, but it's actually used in ITP, which is idiopathic thrombocytopenia, which my niece has. Basically, you have thrombocytopenia, but they don't know why. So he gave him this shot, and he was still on the Granic shots at the time. So he got those shots. The Granics finally started working. I think we had 10 or 11 of the Granic shots. His white blood cell count neutrophils came up. Then the Granic, or the in-plate shot, did not work that time. So this past Friday, he gave him like a double dose of the medication, and Brian's been in a lot of pain. It really causes a lot of bone pain. But we did get his platelets up to 12,000 yesterday, okay? But we're still needing to at least get to 30,000 for him to finish chemotherapy, or we're not doing chemotherapy, I'm sorry, radiation, or also for them to even go in and explore where he's bleeding internally and see if they can cauterize it. And then, of course, they don't like to send you home till you're at 100,000. This morning, his numbers were back down to 9,000. So I'm, and under 10, they're worried about spontaneous bleeding, which obviously he had. So they're going ahead and giving him platelets again today. He's starting to kind of even out, but he's just kind of stuck. So trying to figure out if we're going to give a granic shot, if we're going to give more in-plate shots. The doctor came in this morning and seemed pretty, if you can go 24 hours without a fever, which he's fevered the last couple days, which is more likely just from the in-plate shot, but they did some blood cultures, they've got him on antibiotics, that kind of stuff. If he said he could go 24 hours without a fever, that we could possibly get home. I think he was being facetious. I think that was frustrating to Brian because currently with all the blood loss and everything, so I think we're on number 58 of blood products. I don't know if platelets and plasma are in pints. I know the blood is, but basically he's had 58 or 59 blood product infusions. Brian is actually right now confined to his bed. He can't walk at all. He did stand up to get his weight yesterday, and he could stand up for a brief moment, literally the end of the bed, and walk a few steps sideways to get up higher in the bed to adjust himself. But that's it. He can't walk to the bathroom. He is skin and bones. He's down to 148 pounds. He's lost a lot of muscle. So yeah, basically he's nervous to come home, and my ability to care for him, which is totally fine. I mean, I can take care of him, but anyway, I've taken care of him the whole time we've been at the hospital. We've hardly ever, unless I've been gone, had the aides or the nurses do any personal cares or anything for him, or toileting or anything like that. So, but that's kind of where we're at. We've been trying to get him to eat food. He's so nervous about bleeding again that he doesn't want to eat food. He doesn't want to agitate his intestines. He's only had Jello and broth basically since the 21st of March. Trying to get him to have some soup and stuff today. I was leaving for work for a little bit, and so he didn't want to do it till I got back. In case something happened, I was with him. So we will see how that goes. I'm going to try and get him to eat some Greek yogurt or something like that. There's really no reason he can't eat at this point. Just be cautious with what he eats and start out slow. He is still on TPN, which is another reason I think the doctor may have been a little facetious, because I don't want to have to do TPN at home. I mean, I'll do it, but we need to get him eating and able to stand and walk up the stairs, so on and so forth. So it's kind of where we're at right now. I mean, things aren't terrible. They're not awesome, but we're very grateful for the last few days. He hasn't had any bleeding episodes. He has no, he has no signs of bleeding currently. But obviously, being in the hospital for 22 days, he's quite gun shy at trying lots of different things. He's just so exhausted. So, we'll get him out, hopefully get some vitamin treatments and everything. I told him, I said, I guess if you can't come home, we might be talking about rehab for a little bit. I guess we'll see how that goes. But like I said, I think the doctor was a little facetious about getting him out. The other doctor didn't seem to think that he was going anywhere until his platelets were at least 100,000. And he needs more therapy. I mean, he's going to need some intensive therapy to help him stand up and get around, and that he's not bedbound. But anyway, that is pretty much the update. Nothing really major to say, except for I'm sorry again for our dogs. If they're barking, I apologize. I check on them. Aiden's come to check on them. So we're just trying to hold the house, the business, and Brian all together, and we're hopeful in this next week that things will start getting better and better, and hopefully we'll figure out his immune system. It did go up. They were all in normal range. Now it has decreased again since his platelets started going up. His red blood cells started going down, as well as his white blood count. So we don't know if his body just can't make all of them together or what the situation is. So we're just trying to get him better so he can come home. But anyway, thank you guys for all your thoughts. We had a cute Easter basket on our steps from the primary. I kind of peeked at some of the cards. I didn't open everything because I want to be able to do that when Brian gets home with him. Thank you for all the little treats, the texts, the calls, the everything. Really the only thing we need at this point is prayers. Please pray that he will continue to get better and be able to come home, and that he will have somewhat of a reprieve from this. It seems like we found out he had brain cancer, and since then his health has been super declined since the brain surgery. So we've had good days here and there, but mostly he's just been exhausted and then sick, and so I would like to give him some time to at least heal. We won't be doing Timidar if we decide to do the radiation. The radiation oncologist really feels like he should finish the 6 treatments, which is fine. We won't be doing the chemotherapy with it though, and then he's supposed to get on Optune. So, and I don't remember if I told you guys, I did make them do a scan on him not even a week after he stopped chemo and radiation, which they don't normally do that till 4 weeks after, because radiation can cause changes in the brain that looks like growth, or what's called pseudo growth. Anyway, his honestly, his MRI looked pretty phenomenal. The parietal lobe, I told you, so he had the 2 main ones in the frontal lobe, and they were able to take the one out. The second one was in the motor cortex, so they didn't. That one grew like 3 times before his radiology doctor's appointment to get him in radiation. And then on that scan they also found 2 more, one parietal temporal lobe and one parietal lobe. They thought that the chemo and radiation would take care of the 2 smaller ones on the parietal. The one is gone. The temporal parietal one is still there, and that one, I don't know how they do measurements because it said 1.7 on the scan, but the original one, and this one said 1.5 by 0.8, so I don't know if it's because it has the 2 numbers on there, but they said it had gotten larger, but I'm thinking that's pseudo growth, which means a lot of times the tumor will expand before it goes away. They did say there was some necrosis and edema in that area, but overall his mind's been super clear. His balance has been good. His eyesight's been good. So we haven't had any of that. So continue to pray that that will continue to be good. We would have another, I think it's next week, at the end of the week would be our 4-week scan. So hopefully we can get that 4-week scan. I would like to do that prior to finishing the 6 radiations, just to kind of see where we're at, and then hopefully be able to get him on Optune as well as soon as possible, because likely with how debilitated he is, he's not going to be a candidate for Timidar for a while, and so we won't be able to do chemotherapy. And the other chemotherapies or medications that are available to him also decrease platelets and everything else, so we're just going to have to do natural stuff, which is totally fine. I've got everything ready to go, and we'll go from there. So anyway, keep texting, keep sending well wishes, keep praying, and I will keep you guys updated. Have a great day.